Crisis response procedures. Protocols for responding to behavioral health crises, immediate and long-term crisis management strategies. Introduction. Let's start with a brief overview of crisis response in behavioral health. Well, having protocols for responding to crises is incredibly important. They ensure that we can handle situations effectively and compassionately. Now let's talk about the key elements of immediate and long-term crisis management strategies. Protocols for responding to behavioral health crises. First up, initial assessment. This involves conducting a quick and accurate assessment of the crisis, determining the severity and immediate needs, and ensuring the safety of the individual and others. Next, de-escalation techniques. Using calm and clear communication, employing techniques to reduce anxiety and agitation, and establishing rapport and trust are crucial steps. Then, we have crisis intervention, providing immediate support and stabilization, addressing immediate safety concerns, and utilizing crisis intervention strategies appropriate for the situation. Following that, emergency protocols, knowing when to call emergency services, coordinating with law enforcement, medical personnel, and crisis teams, and ensuring a smooth transition to emergency care if needed. Finally, documentation and reporting. Keeping detailed records of the crisis event and response, reporting to appropriate authorities and agencies as required, and maintaining confidentiality and privacy are all essential. Immediate crisis management strategies. Let's begin with safety planning. This includes developing a personalized safety plan with the individual, identifying safe places and people to contact during a crisis, and including steps to reduce immediate risks. Next, support and stabilization, providing emotional support and reassurance, offering basic needs such as food, water, and shelter, and using calming techniques to stabilize the individual are all vital. Communication is also key. Keeping communication clear and straightforward, listening actively and empathetically, and avoiding confrontational or judgmental language can make a big difference. Lastly, resource mobilization. Identifying and contacting support networks like family, friends, and professionals, utilizing community resources and crisis hotlines, and coordinating with crisis response teams and services are all part of effective crisis management. Long-term crisis management strategies. Follow-up care includes scheduling follow-up appointments with mental health professionals, monitoring the individual's progress, and adjusting care plans as needed, and providing ongoing support and resources. Therapeutic interventions involve engaging in individual or group therapy, utilizing cognitive behavioral therapy or CBT and other evidence-based practices, and incorporating family therapy and support. Medication management entails assessing the need for psychiatric medications, ensuring adherence to prescribed medications, and monitoring and managing side effects. Building resilience focuses on teaching coping skills and stress management techniques, encouraging participation in supportive community activities, and promoting healthy lifestyle choices such as nutrition, exercise, and sleep. Case study, immediate crisis response. Background. Sam, a 14-year-old boy, is experiencing a severe panic attack at school. Response protocol. The school counselor conducts an initial assessment, uses de-escalation techniques to calm Sam, and contacts Sam's parents and a crisis intervention team. Immediate management. The counselor provides a quiet and safe space for Sam, offers emotional support and reassurance, and develops a safety plan with Sam and his parents. Outcome: Sam is stabilized and safely transitioned to his parents' care. A follow-up appointment is scheduled with a mental health professional, and the school implements a support plan for Sam's return. Case study: long-term crisis management. Let's dive into the background. Emily, a 17-year-old girl with a history of self-harm and suicidal ideation. In the initial crisis intervention, there was an immediate assessment and stabilization in a hospital setting. A safety plan and emergency protocols were developed. For long-term management, Emily engages in weekly therapy sessions, specifically cognitive behavioral therapy. She has regular follow-ups with a psychiatrist for medication management and is involved in a peer support group. The outcome? There has been a significant reduction in self-harm behaviors. Emily has shown improved emotional regulation and coping skills. She now has a strong support network and ongoing mental health care. Challenges in crisis response. Let's talk about some of the key challenges. Rapid assessment needs. Ensuring quick and accurate assessment in high-pressure situations. Balancing thoroughness with urgency. Resource limitations. Addressing the lack of access to immediate and long-term resources and navigating system limitations and barriers. Coordination and communication. Ensuring effective communication among multiple responders and coordinating care across different services and agencies. Stigma and misunderstanding. Addressing societal stigma related to mental health crises and educating the community and stakeholders. Strategies for overcoming crisis response challenges. Here's what we can do. Training and preparation. Providing regular crisis response training for staff and conducting simulations and drills to prepare for real crises. Resource development. Building partnerships with local resources and services and advocating for increased funding and support. Enhanced communication, establishing clear communication protocols, and using technology to facilitate information sharing. Community education, conducting awareness campaigns to reduce stigma, and offering mental health education and resources to the community.